Welcome back. Abnormal curvature in the spine is known as scoliosis, and what you're seeing now is the spine of a person who has scoliosis. The spine curves sometimes in an S shape or sometimes in a C shape sideways.
Now, if left untreated, this condition can lead to other health problems. Scoliosis hits 2 to 3% of all adolescents, and to girls more than boys. Now, the typical way many doctors treat scoliosis is to wait and see how badly the spine curves, and if it's bad enough, give them a brace or perhaps surgery in the future.
Our next guest disagrees. He has an alternative way to treat scoliosis, and he's documented it in his new book, Health in Your Hands.
That's right. So let's say good morning to its author, Dr. Kevin Lau, chiropractor and nutritionist, and Isla and Blair, a scoliosis patient. Good morning, and thanks for joining us.
Good morning. So let's start with the very basics. How does someone know that they've got scoliosis?
The easiest way to determine whether or not someone's got scoliosis is merely just getting the person to bend forward. This is normally called an Adams test, and what we're looking for is any unevenness in the back, or what we call a rib hump. From here, we normally go through a definitive diagnosis where we take an X-ray.
Okay, so if left untreated, how bad can it get?
Okay, let's say a severe scoliosis, like a curvature that's over 70 degrees. It normally involves a severe twisting of the spine. That tends to compromise a lot of the hearts and lungs. It might lead to a poor circulation as well as less of oxygen.
Okay, so there are different extremes, but not everyone will result in the most extreme case.
Certainly not.
Okay.
Let's talk about your experience, Isla. You had scoliosis. And how long ago was that actually? You still have it now, and have you...
I got diagnosed with scoliosis 2 years ago.
Right.
And it's quite a mild case compared to some of the other patients.
Okay.
And just under a year of treatment with Dr. Kevin, it's so mild now that I wouldn't be considered a scoliosis patient any longer.
Can it ever, I don't know, be cured? Or it just improve? You can't improve it, can you? You just prevent it from getting worse. Is that how it works?
We can reduce it to an extent. I mean, total correction is probably not realistic, but we can certainly prevent and also reduce it.
Right, okay.
Isla, when you first discovered your scoliosis, you went to see an orthopedic surgeon, I believe, or...?
I went and saw a neurospine surgeon.
Okay.
And he recommended I do about 6 months worth of one-to-one aquaphysio. I went for a month, but then I pulled out because the pain wasn't easing and it was really expensive.
Give us some idea. I mean, when you say the pain was really bad, you couldn't turn, you couldn't bend?
Couldn't turn, couldn't bend over. I got to the point where I was taking codeine painkillers just to get to sleep at night.
Wow. Okay.
What was the degree of curvature in your spine then?
I'm not entirely sure, but it was quite mild.
Okay.
And Dr. Lau, so when you met Isla, I mean, how bad was her spine at that point?
It was about 15 degrees, which isn't a severe case, but she was doing a lot of excessive running and sports that was aggravating her condition.
Okay, so explain to us what your belief is and why you think perhaps braces and surgery is not the best option.
Okay, well, when you look at bracing and surgery, it's really working on the symptom of the deformity rather than the disease of scoliosis. As a natural-orientated practitioner, my main goal is really just to improve the health of the person rather than just correcting the spine. So we do work on trying to correct the spine, but we do so by promoting their health and also looking at what sort of factors is not causing them to grow properly. So we might go into dietary factors or even lifestyle changes.
Let's talk a bit about the dietary factors. Tell us how diet can be tweaked to suit scoliosis patients to improve their condition.
Okay, well, the biggest misconception when it comes to diet is one diet fits all. In the book, I actually detailed the interesting research by Dr. Weston Price. Now, Dr. Weston Price actually studied a lot of tribes around the world, a lot of primitive tribes that actually ate a very holistic or whole food sort of diet, and they were quite resilient when it comes to degenerative diseases such as diabetes, cancers, and even scoliosis. But when they started to switch over to a more modern-based diet with more processed food, they started to get a lot more of these modern diseases that we have today. And the interesting thing is that he didn't find one single diet that was correct for everyone. In fact, he went to the Eskimos and they ate primarily meats and fats, and they had a very low risk of heart disease and cancers.
So maybe I can ask you then, so what then are you prescribing for this day and age? What are you saying people should eat if they're in this condition?
For this condition, I think people need to go back to eating what they're genetically predetermined to eat, and that's what metabolic typing is for.
Okay.
You go through and understand what sort of foods help to push your system back into balance, what sort of foods help to push it out of balance.
I have to ask you, what are those foods? What do you mean by going back to, what were genetically...
So in three basic methods, there's pretty much a protein type person, there's a carbo type person, which is close to a vegetarian based person, and there's a mixture. So during the process, people go through and listen into their body to determine what sort of foods and how much proportions of certain foods they need to eat.
Okay, let me break. We still need, it's a bit hard for someone like us, like me maybe, to understand.
Okay.
But for Isla, for example, what did you prescribe for her condition? What did you ask her to eat?
For Isla, she was more of a protein type person, so I prescribed some more protein in the sense that at least 40 to 50% of her plate was protein based. She ate some vegetables, but also reduced a lot of the simple sugars and carbohydrates.
How long did you have to stick to that diet for, and are you still sticking to that now?
Oh, completely. I love it. For the first 2 weeks, it was a bit sluggish because I was originally eating like a vegetarian.
Right.
So it was a bit heavy for me, but after a month, I managed to sleep completely through the night. My energy levels just went up amazingly.
Yeah.
It made a huge difference.
Are you also doing some exercises? Did you also prescribe some forms of exercises to help?
There are exercises, and the exercises are broken up into 4 different parts. There's stretches, which help with ligaments. There are core stability work, which helps with how the muscles that stabilize the spine. There's also some postural retraining, teaching a person how to sit, stand, and also sleep properly, so then it places the least amount of pressure. But exercising alone is not the only thing. I also do recommend a orthopedic device, which was developed by orthopedic doctors in Europe, which is called a VertiTrack. And this actually puts in a 3-dimensional sort of traction through the spine to decompress it.
Is that anything like a brace?
It is not like a brace in the sense that you need to wear it the whole day, but you wear it for about 20 minutes per day or 2 to 3 times a week.
Okay. But then earlier you were saying that basically you don't do... Is it your opinion that a brace doesn't work?
Okay, that's different from a brace. I mean, this VertiTrack isn't a brace as such.
But it sounds similar to some extent, that you're doing the same kind of stretching, traction, trying to hold the back in place. So, I mean, I'm just trying to clarify in terms of...
Yeah, it's a little different in its mechanism and how it works.
Okay, but so you're saying that a brace, you don't need a brace, basically?
When it comes to bracing, I always let the patients decide whether or not they want a brace.
Okay.
In terms of research shows that the evidence for bracing is still quite weak, unfortunately. And the latest issue of the Cochrane Library actually demonstrated that.
So in a way, your method that you're proposing is a definite alternative rather than complementary to surgery or...
Oh no, it is definitely complementary. Whether or not someone wants to go through a method that involves bracing or even surgery, they can still implement changes such as an improved diet or even lifestyle changes such as exercise.
Okay, so it's rather complementary to...
I guess, I mean, an improved diet would be good in general for all of our, our well-being. Isla, what about yourself? What options did you go through before you considered taking this step? I mean, before you had seen Dr. Lau, what had you...
I did yoga, I did Chinese medicine, I did the aquaphysio, and then I lastly resorted to a whole lot of painkillers.
So you kind of exhausted all the options. And so now, I mean, you mentioned how many months have you, or how many you've been doing this?
I saw Kevin for just under a year.
Just under a year.
Yeah.
How fast can a person expect recovery?
Okay, it really depends on how severe the curvature is.
Okay.
And also how long they've had it. It's not to say that this sort of correction or this sort of care is actually right for everyone. Some people actually need to go through and do the surgical route. And for those sort of cases, you need to really discuss it with your healthcare practitioner.
Okay.
What about managing pain? I mean, brace and surgery are obviously more painful than your method. So would you recommend it for, I don't know, reducing pain specifically?
Oh, definitely. Even a device like the VertiTrack is actually good for slip discs, sciatica, leg pain down the legs and things like that.
Okay. So for those who are a little bit unsure which way to go, because I guess there are 3 options, particularly for adolescents where they're still growing, I guess, and developing. So they can wait and see, or they can go for the brace option, or they can go for surgery. or they could possibly take on your option. What would you recommend? How would they assess what option to take?
I think as patients or even parents, they need to really get informed with their own condition. That's pretty much why I brought out the book. The book doesn't really delve into bracing and surgery as much, but rather the other side of the story. So as most people with a condition, I hope they get more informed and make their own decisions and understand that changing your diet and changing your lifestyle and implementing exercise should be an integral part of anyone's sort of life, regardless if it's spinal health or even health in general.
Yeah. Exercise, good diet. It's yeah. They say they had a saying about an apple a day keeps the doctor away. I mean, then it became an aspirin a day keeps the doctor away. Okay. Well, thank you for coming in, and glad to hear you're doing better, also.
Right.
And we've just been speaking to Dr. Kevin Lau, author of a new book on scoliosis, and Isla and Blind, a scoliosis patient.
And if you're interested in Dr. Lau's ideas on scoliosis,
yeah, there's the book here, Health in Your Hands. You can get a copy. It's available at all major bookstores. Just a word of caution, if you think you have scoliosis, it's always good to find out more about the condition before you plunge headlong into any program. So speak to your doctor, speak to the relevant professionals to clarify the issue. And of course, awareness and education is the best tool to have.
That's right. Well, we're going for a short break now. This is Primetime Morning. Stay tuned.
We'll see you in just a bit.